Hello everyone, I am Dr. Vivek Venkatramani, consultant Uro-Oncologist and robotic surgeon in Mumbai. Today I'll speak to you a little bit about circumcision. Circumcision is a small surgical procedure in which the foreskin of the man is removed. It is a fairly short and straightforward procedure that can be done on an outpatient basis or maximum a day of admission if required. There are many reasons to perform a circumcision. The most commonly done circumcisions are the ones that are done immediately after birth, which are for religious purposes in both Jewish and Islamic populations. These are generally done by a traditional healer, or they can also be done by pediatric urologists or pediatric surgeons. A neonatal circumcision, which is one done immediately after birth, does confer complete protection against penile cancer in the future. This is why penile cancer is never or hardly seen in both the Jewish and Islamic religions. In adults, there is a second peak where circumcision may be required, and this is generally in men above the age of 50 or 60 who are especially diabetic. Being diabetic predisposes these men to recurrent infections along the penis and the glands of the penis, which is known as balanitis or balanoposthitis. And because of their diabetes, they are unable to clear these infections quickly. As a result of this, the skin of the prepuce becomes quite tight and may be difficult to retract, and further reinforces this vicious cycle. The penile region also then becomes a source of infection for bacteria to travel up the man's urethra and cause recurrent urinary tract infections in this particular population. Therefore, this is the second most common population in which we do circumcisions: elderly diabetic males. Other common causes for requiring a circumcision include phimosis, which is a complete inability to retract the prepuce or the foreskin. A lot of children are not taught that they need to clean under the prepuce and retract it every day during their bath or shower. And as a result of this, when they grow up, they find that the prepuce is completely stuck and cannot be retracted at all. I've often seen some young men before flying to the US for further studies coming in with inability to retract their prepuce or phimosis, and we have to do their circumcision before they go off to study. This is something which needs to be taught to all young boys above the age of 5 so that they in the future will not develop phimosis and require circumcisions. Retraction and cleaning of the glands is essential to be taught to all children after the age of 5 or 6 years so that they can maintain a proper penile hygiene and not present later on in life requiring circumcisions. Sometimes the phimosis may also cause pain during erection or cracks during intercourse, and this may require what is a small plastic surgery known as a frenuloplasty in addition to the circumcision as well. Certain skin conditions like lichen sclerosis or balanitis xerotica obliterans or certain rarer skin conditions may also require circumcision both for diagnosis as well as their treatment. When a circumcision is done, we usually send the skin for a biopsy, and that will give us an idea of the presence or absence of these skin diseases or whether there is any early cancer or dysplasia in the prepucial tissue. These are the reasons where we commonly do circumcisions, but not all phimosis require circumcision. There are various grades of phimosis, and some that are mild can be easily managed with lubricating oils like Vaseline or coconut oil, which may help the penile skin to be retracted properly. We also use certain creams to help the penile skin to heal better, as well as to treat whatever little infection there may be at that time. If these creams and conservative management is successful, then these men may avoid circumcision. Moving on to the procedure itself, circumcision can be done both under local anesthesia or some form of regional or general anesthesia, depending on the patient's comfort and fitness levels. I commonly do it under local anesthesia that allows good pain relief for at least 6 to 8 hours after the procedure as well. The patient can walk in and out of the operating room and he's probably ready to go home in 4 or 5 hours after the procedure. The traditional way of circumcision involves cutting the prepuce and stitching it together. Today, newer techniques are available which include certain absorbable staplers, as well as rare cases we do laser circumcision, especially when a man is on blood thinners. which may not be stopped. However, there is no real great advantage of these newer techniques, and the traditional method works really well in more than 99% of cases. Following the circumcision, there are a few precautions that every man must take, because the area is quite raw and rubbing or friction may aggravate the man's pain and may delay healing. Especially a lot of these men are diabetics, and in them the healing is anyway slow. So we would not like to add any further impediments to that process. So generally we recommend that the man wear loose clothing like a dhoti or lungi or loose pajama for at least 4 to 5 days or up to a week after surgery, depending on his pain and recovery. He is advised to abstain from any sexual activity or any masturbation for at least a couple of weeks after the procedure. Actually, the man himself will be the best person to judge when he can actually go ahead and perform those activities, depending on his pain and discomfort. Like any surgical procedure, circumcision is also associated with some side effects or sequelae. There may be a little bit of pain, which is generally manageable with oral analgesics or even sometimes topical creams after the procedure. Most men are quite comfortable and are walking from the same day. It's just the loose clothing which is necessary. Sometimes, especially in elderly men who may be on blood thinners, there may be some bleeding from the surgical site. In those cases, we may need to apply a little bit of a compression dressing, and generally it heals without any further problems. So in conclusion, circumcision is not purely a cultural procedure. There are definite medical indications for which we perform circumcision, and in adults, the most common reason is diabetes and recurrent infections in that area, and also a risk of repeated urinary tract infections because of that particular problem. It is a safe and relatively straightforward procedure. Most men will be home the same day, and the results are generally excellent. If you found this video informative, please like and share it with others, and don't forget to subscribe to my YouTube channel. Thank you.